Welcome to Equine Euthanasia and End-of-Life Options, a veterinary roundtable presented by the Maryland Equine Transition Service, a program of the Maryland Horse Council Foundation. Please be sure to watch all 4 parts.
You know, Dr. Gardner, I think that you bring a lot to the table here as dealing with small animals, because I think on the whole, euthanasia tends to be more widely accepted for the small animals, whereas with the larger equines, we do tend to see a bit of pushback, as we've been talking about. So I'm just kind of wondering if you have any words of wisdom on anything that we can do in the equine world to kind of help decrease that taboo that the small animal industry has done so well at.
I know. This is a fascinating time for me right now. So this has been great. And is it a mixture of the demographics and just the attitude? Because there is more of a use purpose to some horse, to some equine. And my cat. I remember one time I gave a lecture in Texas, and it was Texas veterinarians. And I was doing my quality of life talk, and this gentleman raised his hand. And he's like, "I've been a vet for 50 years, and I just tell people that when they're of no more use, that it's time to euthanize." And so I was like, "I'm glad that's working for you, but my cat's been useless since day one, and I don't like putting her down, right?" So there's been a cat rolling around Justin's office, and I don't think he's very useful. But so
no. He's very useful. He
catches things, the dust mites. The dust balls. So there's a little bit of that. I think this disposal thing, I think, is a massive problem. I really do think this is a big issue. And dare I say, maybe also besides the disposal part, the bigger the animal, the bigger the presence, the bigger the part of somebody's life. Listen, my little cat is just as, takes over my world. But, my Doberman is 110 pounds. And when he died, like, it was such a massive loss of space, loss of presence, loss of silence was deafening when he was gone. And I wonder if that's it's a harder loss, maybe. I don't know, because loss is loss, no matter how small, right? But is there just something different? So I think it takes time. Listen, in-home euthanasia for your dog or cat has taken time to become more of the norm, and now it is. And it's just constant education, and veterinarians need not be shy and turn away from this topic. Owners want to talk about it. And I think we're so shy. Even the conversation needs to be trained to the receptionists. When somebody calls in to talk about it, they can't, struggle. They have to be confident and compassionate and know the answers and have this discussion, because sometimes they're not going to get to a doctor for this conversation. And it is our frontline staff that needs to have it. So educating them, having education on your website, having talks, like doing public talks about it, and making it not taboo will be massively helpful. But there's still a little taboo in our space too, and it's still there. And just be resilient and keep going, and having conversations like this is helpful.
One of the reasons I love Dr. Mary Gardner is just because we can talk about comparing our industries, right? The horse industry versus small animal. I love comparisons, and I know I just had a chat with her just a couple of days ago about the number of animals we euthanize, and certainly thinking about that, I thought it was interesting. And so I looked back at my records, and we have a 2-doctor practice, thinking about how many horses we euthanized over the last year, and then of course nationally what you've come up with. And I thought that was very interesting, and I'll just share with you, with the crew here, about how many horses we euthanized. So for 2 doctors, we euthanized about 56 horses last year. And so for me, that's a 0.5 animal per week, right? If we want to try to do it that way. And I thought, Dr. Gardner, what did you say then for the small animal space was?
Okay, yeah. So I teamed up with a data intelligence company. So we pulled data from GP practices across the country, so just all demographics and everything. And on average, a full-time veterinarian will have an active client base of about 1,000 pets, and they will. So that might be different too, right? And they will euthanize GP doctors 1 pet a week on average. ER is about triple that. for obvious reasons. So, so us veterinarians need to know that we will probably euthanize 50 pets per year. It's about 10% of the small animal pet population. So 10% will die every year. Weird that I know these numbers, a little creepy. It's always fun to go to dinner with me, but I have to know it for both lap of love and also for my crematory. How much, you know, do I need to be prepared for in this space in our demographical region? So it's interesting. Half of a pet for a week for you. So
Yeah,
two a month, let's say.
Yeah.
And how many active clients or patients do you have? Is my next question later on that you can go look at, right?
Yeah, I need to check that number, because of course that's going to change every year. It's going to change every year, but I need to look at that number. It's a good number.
I would
say
our numbers are about the same, Justin. I'm just thinking we as far as large animals, we're probably a 1.5 doctor large animal and 5 doctor small animal. And I would say probably, you know, we would be about the same for horses, and small animals probably, I would say, again with Mary, like 300 a year between 5 doctors. So that's about the same numbers.
Okay.
I think that's helpful too for veterinarians when we're stressed about doing euthanasias and stuff. Like it's be ready. Also in vet school, it's 1 a week, like, which could be shocking to new veterinarians. Like that may seem a lot, and when you're like us doing 4 a day, it's a little bit different. But so on average, it's one a week.
Dr. Radu, do you have any off the ideas about what your rates are at Damascus Equine? Are they similar, do you think?
Yeah, I'd have to go back to pull them up. I just added one to mine this morning. So I'm 1 a day starting today.
It's interesting that the rates are kind of similar. That there's some consistency there, and I'm not sure really exactly what that means, but it's interesting that it's consistent across the practices there.
And what I also think too is it means we need to be good at it. Like this is not a one-off thing. This is, you know, if you're going to be doing 1 or 2 somethings a week, you need to be good at it. If I'm going to do a certain surgery once a week, I should be good at it. And that's where, when I lecture to veterinarians, I'm always, you know, hospice geriatric euthanasia, and I want them to be really good at it. And I hope that at the equine conferences that this is also a topic that's talked about, and end of life care and caring for the pet, caregiver fatigue and all these things, because it is just as important of a procedure as, I was trying to think of an equine procedure. I was going to say TPLO, but that's my world. So
Now, Mary, I also want to compare something else with you. Certainly, in a more recent study that I just was reading this morning about the most frequent health reasons for euthanasia in the horse population, one is, it said something about 25% is laminitis related consequences. 2 were at colic, about 21%. Non-laminitic lameness is about 20%, and age-related deterioration, etc., quality of life is about 20%. And so, you know, I think certainly when we're thinking about these quality of life scales and so forth, you know, for me, it's about colic or lameness or laminitis, right? Laminitis, colic. And so those are the top 2, but certainly there are other things that are very important. In small animal space, top 1, 2, 3.
This is a great question. I always thought, by the way, I'd be like the cat whisperer because I'm going to homes and, you know, cats don't like to travel. And so it's dogs, large dogs, and mobility issues. Number 1, hands down issue. And that might be the small, my in-home space, because they can't get to a clinic, and I've got to get there. But even when I was in GP, I think anecdotally it was mobility issues. For whatever reason, everybody assumes it's arthritis, but there's sarcopenia, there's degenerative changes. My dog had cancer in her spine, and like I said, sadly, 50% of pets are not seen during their geriatric phase. So sometimes the diagnosis isn't done, and so we're dealing with symptoms. So it's mobility is the symptom for whatever the cause. And up next is cancer.
Okay. Yeah. So I guess in our equine space, we're talking maybe about 45% then for mobility, laminitis and lameness together. So we're talking 45%.
Yes. I'll get you my
As
stat on my mobility. It's just as probably high, 30% probably at least. Kitty cats, we see 30% cats, and usually people don't. It's kidney failure or cancer in kitty cats. But so I'm going to stick with dogs just because slightly closer in size. Mobility is number one, and that's where becoming, dare I say, an expert at helping a family set up their home to manage a mobility pet is important. And same thing I think with a barn and making sure that they've got ease of access to things and safety and things like that. I think it's just as important. Look, I'm ready for a horse. I got some people I can call if I need help though, because I don't know a darn thing about horse.
Justin, I'd have to say that catastrophic orthopedic injuries is that's a pretty significant percentage. Maybe that's on my mind because that's what I saw this morning. But
okay.
And so he brings up a good question, like it's the catastrophic or the emergent things, and I think sometimes those are easier to euthanize because it's like we have no option and this is it. That could be hard because owners aren't prepared. It's the long-term chronic slow, what I call the slow declines, that man, those are hard and for owners to go through and know when to say goodbye. And so,
especially when they're seeing the pet every day, and if it's a slow decline, you don't see a month apart.
Yep.
And I think that happens in horses as well.
So for you guys, I would say take video, and I say this in my small animal, take videos and pictures to show the difference of how they, what their stride looked like a month or two before versus now. And you can see the difference. Like if I looked at a picture from our vet school days, I'd wonder where my 25 pounds came from and why, like, all of a sudden it just appeared, but it didn't. It's slow. And so watching pictures and Dr. Cowan just got my joke, but it was helpful for me and my own dog is to watch a video from just 1 year ago. And I'm like, ooh, it takes your denial goggles off a little bit is to see those videos. And so I think it's super helpful for those slow declines, not the cliff, the catastrophic cliff, but the slow declines.
I did a similar thing for my dog. We lost one of my dogs to lymphoma a few months ago, and it was the same kind of thing. I took a video a couple months previously, and then we compared it to his present movement, and it was, I mean, for me, it had been a no-brainer already, but I had to convince others in my family, and it was a really useful tool in showing like this is 100%. A legitimate decline. It's time, so that is a really interesting thing. Or even just to, even if as vets you don't take the video, to suggest that owners take a video.
That's what I do.
Every week. Yeah, just like on a Monday morning at 8 a.m. you take a video.
You know what? That's also very helpful. Okay, I'm sorry. I feel like I'm totally taking over. But what's also helpful with that is afterwards and dealing with their grief. And I know there's a lot of questions on grief too. It's very helpful for sometimes owners to look back and reflect, to be like, you know what? I did make the good decision. That's why, Justin, too, those quality of life skills are so good, where you could, once the veil of grief is through, then you could say, you know what? He was at a 2 and he should have been at a 9. And now, because I could, grief is one thing, regret is quite another. And if we can remove regret from people, they will grieve better and maybe get another horse one day sooner than later, right? And so those videos, those pictures, those scales are so good even after the fact to help them get through that time. And, for me, it took a week for me to post anything about my girl Sam, because she's quite famous on my Instagram. And now I had to let everybody know that she's an angel now. And it was not what helped me get through the duality of a broken heart and a heart that knows she's okay, because you're in that space of like, and everyone's, oh, she's okay now. And I just, I want to kick them because like, I still would like her, is to see those pictures of Sam when she was Sam, when she was enjoying her joys of life. And that's what you have to reflect on. And so there's a wonderful, magic to having that available to families.
I like that. No, I mean, certainly we tell people, okay, send a video or send a picture once a week or every month or so and let us know how that patient is is progressing. And I think with technology now, you can do that so easily. And then I like the thought of, okay, post euthanasia, we can still reflect, and certainly we all do, right, on our own families, et cetera, right? So it's an important aspect. I like that.
I could listen to you all day, Dr. Gardner.
Yeah, I feel I gotta try to be quiet.
No, it's
That was
just
great.
it's inspiring. So
Oh,
it's
thank you.
inspiring.
Weirdly, I love this topic. Because I think has been so taboo, and like I said from the beginning, we can make it good.
Yeah.
There's a lot of, here I go. There's so much study on grief and helping families grieve, and also that if you're able to say I love you to a human before they die, you will grieve faster. Is proven. So to me, the same thing for my pets. Every day, I'm like, I love you. I'm loving you. I love you. And so for those horses too that are nearing the end, if they could say I love you every day, so that way when they do die, they're not like I didn't say it. I didn't say it enough. And at a euthanasia, I don't want people to say I'm sorry. I want them to say thank you, right? Like that's what I want. And if we can remove that and prepare them and help them, like what a great honor it is to help people through this end of life.
Yeah.
Something I try to think about, and I certainly think about afterlife as well sometimes, and thinking about situations. I think it's important after euthanasia that somebody be with that animal, right? Because the brain is still active, right, for a short period of time. And so I say certain things, right, to that animal, because I want them to feel like, hey, they are loved, and thinking about the consciousness of the brain, even though the heart is stopped potentially, right? The brain is still active, even though it's in a slow decay, if you will. But I think that period post euthanasia, if you will, is vitally important, and I guess I talk to the clients about that as well, and I think that can provide some relief for some good feelings as well, knowing that they were there, right, for that time period.
Oh my gosh. First up, hearing is the last sense to go. So I always say talk throughout the process, which is one beautiful thing with us with the anesthetic, sedation, is that they could be close and talking and things like that. So I understand. Lead shank, I'm going to grab that, or I'm not going to grab that. But death is a process. It's a phase. It's not a moment and a quick moment. And I think in small animals, one thing that we do bad in clinics is we make it fast, and we're like, boom, done, and now let me, process their body and, put them in a cadaver bag and, and move on. And like owners need time. And if they don't, that's okay too. Like it's okay if they're like done and they want to walk away because they've been grieving. But it's also okay to spend an hour laying there with them. Like there's nothing wrong with that. And I've helped owners that say, can I keep them overnight? Absolutely. Let me tell you how to do that. Things may smell a little bit, but that's okay. Let me help you through that. And so many people are taboo about that, and Buddhists keep them out. I learned that a lot in California. I had a lot of Buddhists, and I learned what different cultures want. And if I can make that better, then why not? Like, who am I to say that you can't, love on your pet for an hour after they've gone? Sam was getting a ton of kisses for like all night. Call me crazy.
Yeah.
I've done both. I've done with my small animals, I've done clinic and in-home, and the in-homes were, I'm sorry, my puppy is barking. The in-homes were so much more healing.
Yes.
Because I didn't feel rushed, and because I was able to take the time that I needed, even though the vet stayed there with us. She was non-intrusive, and she just let us do our thing. And I've been to equine euthanasias too, and the vets that I've dealt with for that have done the same thing, taking obviously the precautions that we need to for human safety, but allowing owners to, in the post-euthanasia, say things to their animals. It's good for the animals, but it's so important for the owners and for the people who love those animals. It's so important to allow that space. Grief, generally speaking, is not something that we talk about in our culture. It's in Western American culture.
It's just a horse, guys. Why would you grieve over just a horse?
Right. I mean, even in humans, grief is not something that we prepare each other for. So it's to be able to extend that time to an owner and to understand how valuable it is. I think that's such an awesome thing that you guys do, to allow people that brief moment to begin the healing. That's when the healing begins, I think.
Well, the anxiety's gone.
Yeah.
Because there's a lot of anxiety up to it. I call it the there's anticipatory grief. I call it anticipatory death, because they're waiting. Tomorrow I'm going to do it. At 4 o'clock I'm going to do it. Dr. Sobota is coming in 2 hours, in 1 hour, in 30 minutes, and it's not easy. And once you do it, that anxiety goes away. It fills in with grief. It makes room for sadness and things like that. But there is the moment of he's okay now, and I get that. But that does not replace the grief they will have. And whatever space somebody needs to go through, just let them go through it.
I think for a lot of caretakers, one of the aspects is that they've been spending, X number of hours with extra care with their animals. And once the animal's gone, there's this big hole in their day.
Yeah. Yeah, Dr. Radu.
They don't have anything to replace it.
Yep. Listen, I have an extra 2 hours at least every day right now. Like in my morning, and I'm not ready to replace it with anything else just yet. But you're right. And it's also a purpose that they've had, and sometimes now they've lost their purpose.
Yeah.
And so it's interesting.
What I love what we've done already, and this is what I always think and I see as a progression of these kind of talks. We started with, all right, what are the ways to euthanize a horse, right? What are the AEP guidelines? What's the science behind this? But where have we progressed? We've progressed to the emotional intelligence, and the feeling of euthanasia, right? We're all scientists, if you will, veterinarians here on this call, but we've all progressed. And I think that's what Dr. Gardner has done in her space in the small animals, really brought an understanding to us as veterinarians, right? The human intelligence aspect of this, and the emotional intelligence of what we're trying to do, and that, yeah, all the science is important, but getting to this point of talking and communicating is so valuable, and I feel like sometimes maybe we don't do that as well in our equine or large animal world, even as veterinarians, right? We don't go to a CE and think about, oh, I want to hear about euthanasia for the next hour or two as a CE. No, we've never done that. In your space, you do that
all day.
Right, exactly. So do we want to do that as part of more of our CE, to talk about some of these emotional?
I think, Justin, that you're right, but I think what's happened is that, again, our profession is changing, and, it was at one point a livestock profession, and now it's become a people profession. And so, we need to start thinking about, that most of the, we're not just treating the draft horses that was pulling the milk wagon anymore. We're transitioning to the point where horses, a lot of them are companion animals, and we need to, think more about that versus the strictly performance athlete that, is replaceable, just like the car. You keep it tuned up and lubricated and ready to go, but these are now turning into dogs and cats. And I think society's views on animals as far as livestock has changed as well. And I think that's one thing, you're right, we need to be more aware of that.
That's an excellent point, Dr. Callahan, that there's an ongoing shift of the horse away from use to as companion. And I think that's, I think that maybe that's kind of what happened in the small animal world, 10, 15 years ago. And that helped destroy some of the taboo around euthanasia. So hopefully that will assist the equine industry in that too. That's a really good point. Is there anything that you four wish your clients or people at large knew about euthanasia? Is it okay? One specific question is like a subtopic to that. Is it okay to give a horse their favorite treats or like a last meal right before euthanasia? Is there anything else that you wish people would know when you go to their farm to perform this procedure?
Well, yeah, certainly. I'm for the most part in favor of treats or a carrot or a mint or something of that nature right before euthanasia. Of course, it's all situational, but I'm always in favor of that. I'll let the others speak, and then I have something else to say.
I'm yeah, whatever the horse's favorite treats are, they can feed it up to the time that, we tranquilize the horse. The one thing that if I had to choose is that you need plenty of space. There are a number of times where I've been asked to euthanize horses between bramble bushes and the hole they've dug, and it's not always well directed, and I'd much rather have more space. It's much safer for me. It's much safer for the horse. It's much safer for the handler to have a larger area in which to euthanize, because sometimes you're put into situations that are not safe, and I appreciate the fact that they have only this small area to bury the horse, but it's not necessarily always the safest for the people doing the euthanasia.
I had one memorable one where the people had the hole all dug, and I sedated the pony, and I advised him not to get too close to the hole, and went back to the truck to get the pentabarb solution, and they were concerned that it was going to be hard to drag the pony into the hole once it was euthanized, so they wanted to get it right next to the hole. And when I get back from the truck, everybody's kind of standing around looking down into the hole, and there's no pony to be seen.
Oh my gosh.
I had to crawl down into the hole and euthanize the sedated pony.
Yeah, I've been there too.
See, you guys there's a huge difference, obviously, because of this, and in the small animal space, if they're eating, absolutely. There's my girl having her Valentine cupcakes on her last day, and she had banana pancakes, she had everything. But for me, it is the experience, and that's for us. It's, I don't care what music they want to have. If they want to be alone, or do they want to have a party? Do they want, like, I'm ready for anything. But for you guys, because of that, the danger part of it and the safety part of it, it might even be more important to heighten the before and the after, and making sure that we, support them better before, because there is that moment they need to step away and be safe, and it's not going to be pretty, and everybody needs to be safe. And yeah, Dr. Callahan, I haven't been in a bramble bush and a hole, but I have been under beds and like up a fireplace trying to chase a cat. So sometimes it's not always easy, and we try to make our best. And I think if we prep the owners early too, that way they don't get mad at us, because sometimes their anger and grief comes out at us because it wasn't done perfectly, or what do they expect. And I wish also people knew that this is still life and death, and it's not always perfect. Pet dogs and cats don't curl up in the middle of the night and just pass perfectly and everything is great. And same thing with horses probably. And we will do our darndest to make it as good as possible. But sometimes there are reactions, and sometimes there are, for us it's a bark or a yip when we give our sedation, and they're in pain, and I just gave them a shot. Like, this is what's going to happen, and we get battered a little bit on that. And so I wish that we can all know that we're doing our best, and we're going to all try to do it our best. And for you guys, this is one day I want to go to Maryland and go on a few calls and I'll stay out of the way.
One thing that was pointed out to me by a client was letting the pasture mate see the dead animal and even go over and sniff it. That there's on some level, there's recognition of death and acceptance of it, much more so than if their pasture mate had just been led away and disappeared, that they would be still frantically calling for them.
Right.
I've had some horses that seem to care, and some horses that don't seem to care. That the owner will lead them over, and the horse is totally disinterested and wants to graze, and others that are grieving. So I think that it's fine if owners want to let that happen, but they don't always react in the way the owners think they will.
Yeah, I've had a dog just like walk over his buddy, like just getting to the food bowl, and it's just like humans. My better half has had no emotion over Sam, not cry, nothing, and I'm like a hot mess every day crying over something. So like, we're all so different, and so are the pets. And I wonder, it's interesting because there's been studies in dogs about grief of a housemate. I was gonna say littermate, but a housemate. Very interesting about horses. It would be interesting to know if they are like pasture mates, and they're I feel like they're so bonded to each other a little bit more sometimes.
There was a post from a local rescue, and Emily, I don't remember the rescue name. They posted this really great picture of a herd mate that had been euthanized, and she came in with another mare, and the mare was standing right over, and I don't think she moved for about 3 hours. And the rest of the herd, who were relatively new to these two, formed like a semicircle around her and just stood there for a couple hours. It was really moving and really beautiful. And I think that it's not all horses are going to do that, like you said, Dr. Callahan, but I think it's a matter of managing the expectations of the human, right? They may want to see their other horses, their other herd expressing their grief that way, and not all of them will. Same with my dog. One of my dogs was sad for weeks after I had to put one down, and the other, my second in-home euthanasia, the other one was like, oh, whatever, where's my bowl? So they're like humans. They grieve in different ways, but managing those expectations and providing that opportunity for them, I think, is the most important part of that.
Goes to show you how sentient, like these are sentient beings. Like to know that they do that, like it's just phenomenal and amazing. I want to see that picture.
I think that is one of my more often asked questions. If we were to calculate the number of questions from our clients, I think that is one of our bigger questions, is that, can his herd mate come over and find closure with XYZ? And I think that's really important. We try to do that, and I think it's a valuable thing. So yeah, it's an important question for me. And sometimes I was thinking earlier just about the fact that what do people need to know before euthanasia in horses? I had someone tell me this last year, and I thought it was valuable. Is that horses don't eat because they're comfortable. Horses eat to be comfortable, if you will. And so, sometimes you have these tough, difficult colics, and you get them feeling better with certain, NSAIDs, et cetera, right? And so we get them feeling better, and then they want to eat. It's not because they're always comfortable necessarily, but it's to be comfortable. I don't know if it's necessarily the same in small animal, but I think about that, and I kind of try sometimes to relay that to people, because they're like, oh, my horse is eating now. And I'm like, well, that's not always the best thing, or that's not always an indication that the animal is well.
There's a great saying in human hospice that the food and water are for the living, and the body won't eat or drink for a future it knows it doesn't have. And I say that a lot to my end stage, patients, like the families of the end stage patients, because they're chasing the cat around with a tuna fish and canned, and the cat now has anticipatory reactions to the family coming out. They just want to lay in a sunbeam and be left alone, and the body is going through its process, and it happens in humans too, that they slowly need the less requirements and the desire for food or water, and sometimes giving them that actually makes them worse in the human space. So
yeah,
all interesting.
Well, we only have about 10 more minutes left in our kind of scheduled time, but if anyone has any closure comments, I think that would be great. I mean, we've definitely kind of spanned as much as we can within this 2 hours. I think this topic is something all of us could go on and on about for days on end, because there's not like a black and white option. It's not usually linear. It's all very unique to each individual. And I think that goes for equine and small animals as well. So
the only thing I'd like to bring up is grief. And I know Dr. Gardner had brought it up briefly, that there are resources available for grief. I think people don't know where to look, and I honestly refer them to Dr. Gardner's website.
Thank you. I was gonna say we do have a counselor on staff actually, and people could call. Does not have to be a Lapalove person or client. So thank you, because they need it.
There's also a Facebook group that's kind of a spinoff of Horseback Corner, which is a pretty popular Facebook group. Dr. Gardner, there's a pet one too.
Yeah.
But it's a specific group for owners who have lost their horses. And that seems to be a pretty good resource as well.
That's great. Yeah, only 20% of small animals, see, I know all these weird stats. 20% of small animal practices give information about grief to families. And not everybody will need it. Not everybody's going to need, that, but they ask about these things. Justin, right? That's your number one question is what about give them information for their own grief, for other pets. We give a booklet out at every euthanasia that talks about housemates and, ways to honor their pet and things like that. And have that on your website and have that available, because those that need it are searching for it and they're too shy to ask. Maybe they don't want to be the ridiculous one that's been, grieving for a month over their horse. There's nothing wrong with that. You love your horse.
Yeah, I think sometimes there's a guilt about grieving for animals that feel like it's inappropriate.
Yep. And it's not inappropriate. It's totally healthy. See, Justin, your cat's still useless.
Just sitting there.
Not even a sunbeam.
If I was that Texas vet, it would be time.
I just think it's a lot of fun to have this discussion with all of you, because everyone does bring a different perspective, and I think that's the value of our conversation today. So I just want to thank all of you guys for participating. This is great.
Yeah, oh, sorry, my dog. I second that. This has surpassed my hopes, and I can't wait to get this out to the public and hopefully, just make a little bit more of a shift in the conversation and make it more, less of a frightening thing for people. I'm going to mute now because my dog is barking.
Well, thank you guys for having me. I'm humbled to be here, and hope I gave some good advice or just a perspective. And I'm so open to learning so much. My favorite rotations in vet school was actually my equine rotations, and it was just, there's nothing as amazing as being in a barn and just hearing them, and I just loved it. I wish I was born and raised in that world, because it would have been easier for me to be a part of it. So it's been really fun to be here to talk about such an important topic. So thank you guys.
Yeah.
Thank you for your, thank you.
You all brought so much to the table, and, Katy and I think we try so hard with METS to open up this conversation. But, we're just horse people, we don't have a degree in veterinary medicine. And so there's so much value to just, opening it up to you guys, having everyone's different points of view. So we really thank you for your time and all that you could bring to the conversation.
Well, thank you for putting it all together.
Yeah,
Yes.
thank you.
Yes, thank you.
Thank you so much. And maybe we'll do another one of these. So watch for emails from me.
Awesome.
All
Thank
right.
you guys.
Thank you guys. Have a
so
nice
much.
day.
Yeah,
Enjoy
bye.
the lovely weather outside.
Yes.
Bye-bye.
Bye.
See you.
Bye.
Thank you.
Thank you for watching. Please be sure to watch the other installments of this roundtable. Also, please consider donating to keep METS a part of Maryland's equine community. Let us know if you'd like to see a roundtable about any other subjects. Thank you very much and have a great day.